Hello everyone. Thank you for joining us today. Many of you just attended the Generation Equality Forum, where we had important conversations about creating an inclusive family planning movement. It will take transformative and intersectional commitments to power progress towards gender equality. And it is those transformational commitments that are at the heart of the FP2030 partnership. Today you'll hear from government officials, young people, the disability rights community, members of the LGBTI community, as well as civil society members, about how access to rights-based family planning has ripple effects that extend beyond contraceptive use, and how a commitment to FP 2030 can accelerate progress across a myriad of development goals. I'm honoured to invite Chris Elias, President of the Global Development Division at the Bill and Melinda Gates Foundation, to open our session, along with Saru Imran, FP 2030 Youth Partner, and Mariama Abdou Gado, Vice Chair of the FP 2030 Transition Oversight Group.
FP 2020 set out with an ambitious goal: 120 million additional users of voluntary family planning by 2020. We didn't quite make it there, but we did bend the arc of progress for the better. And we know that the ongoing COVID-19 pandemic threatens that progress. More than a third of countries have reported COVID-related disruptions in family planning, nutrition, and pregnancy-related care. And intense pressure on national budgets means that funding for family planning and women's health is at risk once again. On the heels of the Generation Equality Forum, now is the time for Family Planning Partnership. A partnership that breaks through silos, holds decision makers accountable, and brings together a community focused on building a gender equal world, where women and girls have access to the quality care they need to plan their futures. That's why we're coming together today to tell you about the next phase of FP 2030 and about the partners who have already committed to action themselves. FP 2030 will build on the progress started by the previous partnership, with key changes inspired by what we learned over the FP 2020 8 years of hard work and progress.
First of all, we are excited to welcome more voices than ever before in the movement. FP 2020 focused on 69 countries. FP 2030 is for everyone: government, NGOs, CSOs, organizations working for sexual and gender minorities, youth partner, people with disabilities, etc. We are building a stronger movement because we know that everyone benefits when a girl or a woman or anyone who wants to control their fertility has the right, access and control to do so.
Et ce n'est pas tout. La FP 2030 sera différente de la FP 2020. La FP 2020 était un secrétariat basé à Washington DC. La FP 2030 est en train de construire un nouveau centre régional avec 2 hubs en Afrique, un hub en Asie, un hub en Amérique latine, un hub en Amérique du Nord ou en Europe, ainsi qu'un réseau de champions pour soutenir leur travail. Dans le cadre de cette nouvelle structure, les responsables de l'engagement FP 2030 auront directement accès à leur propre centre régional. Nous espérons que cette approche donnera le contrôle au pays et permettra aux dirigeants et décideurs régionaux de mieux utiliser la puissance du partenariat FP 2030 ainsi que du réseau de soutien mondial. C'est juste une façon dont nous essayons d'uniformiser les choses et de nous assurer que les pays et les organisations locales ouvrent la voie.
Some things won't change. Our vision remains one grounded in agency, decision-making, access, affordability, and human rights. When women and girls everywhere have the freedom and ability to lead healthy lives, make their own informed decisions about using contraception and whether and when to have children, they can participate as equals in society and its development. Together, FP 2030 can unlock a cycle of empowerment for generations to come.
We continue to believe that access to voluntary, right-based contraception is a human right. We want to work with you to ensure that more girls, women, and anyone who want to control their fertility have access and power to do so. Tokenism is not enough. I want to work with FP 2030 to ensure that people from marginalized, stigmatized groups are decision makers, partners, and equals in the new partnership.
Alors, mettons-nous au travail. Pour commencer à élaborer votre engagement FP 2030, visitez dès aujourd'hui la boîte à outils des engagements sur le site web FP 2030.
This is Nina. Nina wants to make her own decisions about her life, whether to have children, how to be herself, how to stay safe. Sounds simple, right? To carry out these decisions, she goes to a clinic for help. But as soon as she gets in the door, the nurse stops her. She shouldn't be here at a family planning clinic. She's too young. She should come back when she's older and married. She tries another clinic. She meets with the nurse, who immediately suggests oral contraceptives. Nina explains that she's transgender and actually she'd like an HIV test and condoms. The nurse is shocked and angry and tells her to get out, that they don't serve her kind. When she tells a friend about her experience later, the friend sympathizes and says that that clinic doesn't offer HIV tests anyway, just contraceptives. For HIV care, she needs to go somewhere else. Nina could live anywhere, and the roadblocks to get the care she needs could be anything. Maybe she's young, she might be disabled, she might be married or unmarried, but the layers of identities too often add up to keep her from getting the care she needs when she needs it. People don't use healthcare in silos, so when we commit to making progress on family planning, our commitments can't be in silos either. That's what is so profound about the FP2030 partnership. Growing from the momentum of FP2020, FP2030 is mobilizing transformational intersectional commitments to accelerate progress on voluntary rights-based family planning. And to help governments and other family planning stakeholders develop their commitments, we have created the FP2030 Commitments Toolkit. Making a commitment to FP 2030 means joining a global support network, a movement to work with regional decision makers to achieve worldwide results. FP 2030 has 9 years of success to build on, and the new partnership brings forward our greatest strengths while embracing new ways of working to reflect a core commitment to equitable and rights-based approaches. Still, our focus remains the same: one woman with a full life and the power and means to make her own reproductive decisions. But that all starts here at commitments.fp2030.org, a site with everything you might need to create strong transformational commitments. The Commitments Toolkit has an easy-to-follow, step-by-step process to navigate drafting and finalizing a commitment, and resources to incorporate any thematic area: emergency preparedness, domestic financing, rights-based programming, and so much more. FP2030 staff are here to work with you every step of the way to make sure your FP2030 commitment is as strong as possible in order to spark progress for women, girls, and anyone who wants to control their fertility. Questions? Don't hesitate to reach out to us at commitments@fp2030.org.
Hello, everyone. On behalf of USAID's Office of Population and Reproductive Health in the Bureau for Global Health, it's my pleasure to join you today as we celebrate the FP2030 partnership, welcome new commitment makers to the global FP2030 movement, and recommit ourselves to building a brighter future for everyone everywhere, especially women and girls. As the United States made clear at the G7 and more recently at the Generation Equality Forum, equitable access to reproductive health services, prevention of gender-based violence, and programming that is responsive to gender equity and women's empowerment are priorities in U.S. global health and development assistance. USAID's investments in family planning and reproductive health and our continued role in FP2030 at both global and country levels are aligned with these priorities, supporting measurable financial, policy, and programmatic progress towards achieving equitable access to family planning for women and girls. We also recognize that the need for reproductive health services is not limited by gender identity or sexual orientation. Through our participation in the LGBTI Global Human Rights Initiative, USAID is working to ensure that people everywhere can exercise their rights and have access to the health care they need. Through our partnership with FP2030, we will continue to prioritize making sexual and reproductive health a reality for all, and especially for underserved and marginalized communities. Ensuring that individuals, regardless of their gender identity, social or economic circumstances, have the information to make informed decisions about their health and the agency to act on those decisions, including whether, when, and how many children to have, whether to use contraception and what method to use, is a powerful development intervention that can improve health, propel economic growth, and create a safer, more equitable world for everyone. As we look ahead to 2030, we believe the expanded FP2030 partnership, working across sectors with diverse leadership, will accelerate our common goal of reproductive health care for all. USAID looks forward to working with FP2030 and our international partners. Together, we can accelerate progress through inclusive and transformational commitments to family planning and gender equality.
Hi, I'm delighted to be here today to congratulate FP2030 on a new vision and to share how MSI will contribute to that shared goal of expanding sexual reproductive health and rights. After a year like no other, it's so heartening to see such a collective movement in support of reproductive choice and to see the pledges and the commitments by donors, by governments, and by civil society alike. And at MSI, we're renewing our commitment to work together with all partners to create a world where there is universal access to contraception and that no abortion is unsafe. You know, it's crazy that in the third decade of the 21st century that so many millions of women and girls still lack bodily autonomy. We believe that family planning and access to contraception should be a cornerstone of any movement towards gender equality. And it's fantastic value for money too. We know that we at MSI can provide a method of contraception to a woman or a girl for only $3 per day. So as we look towards the future, towards 2030, we're renewing our commitments. Back in 2012, we made a commitment to provide contraception to 6 million additional users by 2020. We doubled that commitment in 2016, and I'm delighted to say that in 2020, in spite of the pandemic, we were able to achieve that commitment. And we believe very much at MSI, when you make a pledge, when you make a commitment, you have to stick to it and you have to deliver it. So it's great to see that that happened. And looking now towards 2030, we're making renewed commitments. We expect by 2030 to have reached 120 million women and girls with a method of contraception of their choice. And under our Leave No One Behind pillar, we're expecting that 80% of all the clients that we serve will be from the most marginalized and the poorest communities. And that at least 50% of those clients will be under 24 years of age. And very importantly, we're also working towards a different way, a different model of operating for MSI, because in the past we've often worked alone and we've measured against our own base, but in the future we want to focus on working together in partnership with all of you and with all of the movements in support of gender equality to make sure that we're making our contribution alongside national governments, alongside donors and locally based organizations and movements. And we're very, very committed to make that shift in order to ensure that we're closing gaps and not just measuring against our own base. So I'm really, really looking forward to working together with you. I'm really delighted we are able to have this opportunity with FP2030 to reset and to rethink about how we work. And I'm most excited about seeing all of you in person at the earliest possible opportunity. And let's all hope that's very, very soon. So thank you very much.
Hello, everyone. Thank you so much for being with us today. We are going to have a quick micro panel on building intersectional partnerships and commitments. We have some wonderful panelists, and I am your moderator for this event. My name is Lori Adelman. I'm the Vice President of Influence and Engagement at Global Fund for Women. Global Fund for Women is a feminist fund. We've been around for more than 30 years, and we support grassroots gender justice movements to make meaningful change that will last beyond our lifetimes. I'm so thrilled to be here today with three brilliant people, Emily Sullivan, Shannon Ganapathy, and Dr. Alessandra Adesu. And they're gonna speak today to think more together around what commitment makers must keep in mind in order to actively reflect our lived realities. We do not live single issue lives, as Audre Lorde has told us, and so we do not need single issue commitments. So today we're going to have a discussion around what it really looks like to meet the actual needs of human beings, and especially of women, queer folks, disabled folks, young people, but just recognizing communities that are quote unquote traditionally underserved or quote unquote vulnerable. We know how they got that way in the first place, which is exploitation, colonialism, all of these problematic historical actions. And so we need to right these wrongs, and we need to do it on the people's terms and not on the donors' terms. So how are we going to do that? How can we make sure that happens? I'm going to turn first to you, Shannon, and I'm going to ask you just first of all to introduce yourself to the people. They want to know you. They want to know who you are. Tell them about your work. And I also I'm hoping you can speak a little bit more to LGBTQI communities because they've historically been left out of this conversation. That even the term family planning, it sort of evokes this kind of heteronormative idea of what a family even is. And I don't personally know a ton of queer folks who kind of use that term frequently in their day-to-day lives, and certainly not in relation to their sexual and reproductive health and rights. And so how do we make these things come together? And how do you respond to the people who might not be centering LGBTQ communities because they say maybe there's too few of these folks included in the populations that they're trying to target?
Thank you so much for the introduction, Lori. So hi, everybody. My name is Shannon. I'm originally from Mauritius, but I'm currently based in Kigali, Rwanda. I'm a current master's student at the University of Edinburgh, where I'm focusing my research on queer communities on the African continent and how we build community online, given certain very difficult situations, sometimes physically speaking, and thinking about legislations. I think it's great, Lori, that you've already kind of gone ahead and mentioned the C word, colonialism, and doing research about queer communities on the African continent. Obviously, that does come up a lot. Why are some of the laws even in existence right now? But let me try to take a stab at the question that you asked. I think oftentimes within our field, other fields really, people tend to make a utilitarian argument for anything. It's about the number of people, it's about, the percentage, statistics really. But I think when you come at any problem from a human rights perspective, then every single human life matters, right? It's about dignity, and it's about being able to cater for the needs of people, just full stop. It doesn't have to be, we are a certain number of people, and that's when we should care. So absolutely, I think the term family planning, it does feel a little bit archaic. In my previous work, personally, I really, really liked the idea of having SRHRJ, with J added in there, justice, and thinking about SRHRJ as this comprehensive umbrella term that really captures people's needs, including those in the queer community, much more so than, just even FP would. So yeah, I think that I'm just going to kick us off with that and see where the conversation leads us.
Love that. Thank you so much, Shannon. And I mean, I just want to ask a follow-up, which is, okay, you know, we know the long-lasting impact of colonialism on the continent. You must see this, you know, so much in your work, you know, how all of these things still manifest today. So what can be done today, you know, in just a few sentences, folks who are looking to make commitments and be accountable to serving the queer community and their sexual and reproductive health and rights and justice needs? What should they be thinking about? How should they be crafting commitments to meet needs in these areas, to ensure they're intersectional, to ensure they're meeting people where they actually are? What advice would you give to those seeking to do good in these areas?
Well, that's a great question. I think those seeking to do good in these areas just have to recognize all the different kinds of phobias that exist. You know, I've had some experiences working for even international organizations based on the continent that, you know, seek to supposedly create or carve out a safer space for queer individuals. But because of certain legislations, they also just want to curry up the favor of different governments. And so they never really quite take a stance. And, you know, sometimes an organization not taking a stance will have a, you know, that benefit to them, or that, you know, they'll be able to operate within a certain context just fine. But I think being able to take a stance is necessary. It's essential. It's just crucial. So I would say to anybody trying to, you know, be doing work, you know, especially in the global South, and grappling with the ramifications of the different types of colonialisms that have taken shape, to just take a stand. You know, a bit cowardly to kind of come in and, you know, not be willing to say, you know, we are here and we want to stand with the queer community and we want to be a safe space. But at the same time, I think when I'm sharing this, I'm coming at it from the perspective of thinking of, you know, these foreign, especially very much foreign, mostly American institutions kind of coming over. But even then, you know, even within that, there's so many issues to think through. Because at the end of the day, maybe, you know, we should just completely even move away from having these institutions be coming from somewhere else and trying to come in here and try to fix things. But if they do, and they already are here and they're already coming, and so it's already happening. So to do it better than, you know, take a stance, you know, just be courageous and, you know, offer an actual safe space and don't just say you are.
100%. Shannon, I'm hearing you reckon with something that I reckon with all the time, which is how do we completely upend the system which is not serving us while also making incremental change, you know, day to day with working with the institutions that we have today. So I hear you, I appreciate you, there's nuance there. I want to turn to Dr. Alessandra Aresu, and based on your amazing work with humanity inclusion, I really want to hear a little bit more from you in thinking about countries, governments, writing their FP2030 commitments. What's the first step to ensuring that those commitments are inclusive of people with disabilities? And I'm particularly interested in what resources commitment makers should be using that already exist, because we know, you know, the evidence is there. So what should guide their thinking in these areas?
Thank you, Lori. And I'm Alessandra Aresu. I'm the Director of Global Health at Humanity and Inclusion. And I'm a specialist on gender, sexuality, and disability. And I'm very, very happy to be today here with you. I would like to also introduce myself a little bit in an inclusive way for those of our public, our audience that cannot see us, saying that I have an oval face, long brown hair, and brown eyes. and I'm wearing a colorful top. This is the first step of inclusion and making sure that everybody can really appreciate us, no matter which is their abilities. When going back to your question, Lori, thank you for asking this very important question, because of course, the very first point to keep in mind when we are discussing about how countries can be most inclusive, preparing their commitments, is first of all to ensure meaningful participation of persons with disabilities and their representative organizations, and especially including women and youth with disabilities-led organizations. Knowing that there is a variety of organizational persons with disabilities out there, but not all of them are represented and participating in actions that are related to sexual and reproductive health and rights. And certainly preparing a commitment, FP2030 commitments, is a great opportunity to really promote this meaningful participation. So those who are in the action of writing and preparing the commitment should call for their participation. And in parallel, also they can take the opportunity to also have the support of organizations like international non-governmental organizations that are present at the country level, that work on disability inclusion and sexual and reproductive health and rights, to ask for their experience and expertise, because organizational persons with disabilities and international NGOs working on disability and inclusion are complementary in the work they do, and they can really give together a great support. And the coordination between all these forces is really what makes a very participatory and inclusive commitment. And when it comes to resources, it's also very important because there is a lot out there available. First of all, and to refer to the UN Convention on the Rights of Persons with Disabilities, several articles are available that can be very helpful when it comes to sexual and reproductive health and rights and family planning. Certainly the one referring to health, Article 25, but also Article 23 on the respect for home and the family, Article 16 on freedom from exploitation, violence and abuse, and Article 6 on women with disabilities. The last point that I want to highlight as a reference is that there is a new World Health Assembly resolution on the highest attainable standards of health for persons with disabilities that has been adopted in May 2021 by the World Health Assembly, and explicitly refer to sexual and reproductive health and the rights of persons with disabilities. So this is also a big frame within which everything that now today we do when it comes to inclusive health and sexual and reproductive health we should take into consideration, together, of course, with one of the key documents that is already out there for since some time, that is the report of the Special Rapporteur on the Rights of Persons with Disabilities, Jacqueline on sexual and reproductive health and rights of women and girls with disabilities. And I think this should be really giving a good start to those of all of you that are committed to write a commitment on Family Planning 2030.
I would say that's more than a start. Thank you so much for that. And I hope the folks in the audience are taking their notes, because you do not have to start from scratch. There's an entire roadmap for you. It's not that hard. It's right there written down. And I think that was very thorough and clear. And I really appreciate you providing that framework for us. Follow-up question in 1 or 2 lines. I would love to hear from you. What does reproductive justice look like through the lens of humanity and inclusion, especially considering the complicated history that our movement has in supporting the rights of people with disabilities? So what is the opposite of the past? What is that proactive, beautiful vision that we're working all towards together, in your words?
Thank you, Lori. And The first point to keep in mind is, of course, that persons with disabilities are, first of all, persons. So their human rights are the same human rights of persons without disabilities. And so when we discuss about reproductive justice, we refer to everybody, including persons with disabilities. This is the strong message, and I think it needs to be reinforced, because sometimes the persons with disabilities are left behind in the discussions around reproductive justice. And the second point that is very specific to be made for persons with disabilities, and specifically women and girls, is the importance of highlighting how the right to bodily autonomy and to informed consent. Because too often women and girls with disabilities are subjected to forced sterilization, forced abortion, forced contraception, but also forced pregnancies continuously. And this topic has not been addressed enough. It's the responsibility of each one of us to ensure that persons with and without disability, women and girls of every age, when have access to services, do have the right to be informed about the services that are offered, and to choose with full information what they would like to do with their sexual and reproductive life. This is really the basic of reproductive justice for everybody, including persons with disabilities. Thank you.
Thank you so much for that. And as straightforward as it is, it still eludes us for too many. So thank you for sharing that vision that I know we're all driving towards. Last but not least, Emily Sullivan, I want to turn to you. You know, you are really a beacon and a visionary within FP 2030 and have been leading so much of the work within FP 2030 to bring in folks with disabilities, to bring in queer folks, to bring in youth and young people. I'm curious, what do you hope to see as FP 2030 grows and expands and engages in this new partnership? What's your vision for this work?
So first I have to say, beacon feels very strong, but I'm trying, we're trying. I would really actually encourage the FP 2030, the SRHRJ community to actually hold us to account rather than based on our intentions. So that is the first step. But yeah, I'm Emily Sullivan. I'm the Senior Youth Manager for Youth Partnerships. And so now we're really trying to be more inclusive, right? This is a word everyone is getting more and more familiar with of what this actually means. The truth is that not everyone saw themselves in FP 2020. Quite literally did not see themselves in the images and the stories and the word choice, in the data. And what happens is where they saw themselves was in this tagline, right? Marginalized populations, that's in every report that all of our organizations have written at one time or another in parentheses. And so essentially now, you know, we're hoping that no longer will, especially the disability rights community, people with disabilities, the LGBTQI, the queer community will see themselves in FP 2030 going forward. See themselves, yes, literally in the images, stories, data, etc., but more actually in how the assumptions about specifically their contraceptive use, but also about their sexual and reproductive health are no longer, elude people, that actually now, because their stories, because their experiences are part of the fabric of FP 2030 going forward, that those harmful assumptions can no longer just be assumptions. They have to be put in place so that our community has to reckon with them and recognize everyone has rights, and that people with disabilities, as Alessandra mentioned, the queer community also have rights, including access to contraception. And there have been so many harmful assumptions about this, historically and currently. So what this means now is that we're here with FP 2030, no longer FP 2020, is that, yes, there's an argument that I've heard one too many times that many of us have heard over and over, that we can't reach more and more people with less resources or the same amount of resources, right? This is the reality check that people keep throwing at, rights defenders around the world. We all live in reality. It's quite painful sometimes. And so although we recognize that, I think our solution is actually partnership. And there's a young woman, Zikia Muska Ahmed, that works actually with humanities and inclusion. Someone asked her in a live chat that we had a couple of days ago, so I want to work with people with disabilities to help inform my program. How do I go about doing this? And she's like, what do you mean, how do you go about doing it? They're right there. Like, it's not that difficult. Like, why are you acting like this is so hard? And no, I realize it's not quite that simple, but it actually isn't that much more complicated than that. Yes, we have limited resources. Everyone knows that. Maybe if we actually had more partnerships, we could actually try to get more resources to do more advocacy for the SRHRJ, of people with disabilities, of the queer community. But more importantly, in the near term, if we actually partner with these groups, these communities, then they'll actually see themselves in FP 2030. We'll be able to actually reach more people with this rights-based approach, which we all claim to be in support of, and hopefully it would actually be realized. And a lot of young people throughout FP 2020 have slowly but surely felt like the partnership was theirs. They now use even the FP 2030 logo all the time without even telling us sometimes, which I think is great, because that means they think it's theirs, right? They think this is our partnership. But in some ways, so what I'm hoping is that the disability rights community, that the LGBTQI community, the queer community, that they also see FP 2030 as a cause that's fighting for their rights as well, and that down the road it actually will be viewed as, okay, I feel proud to represent this partnership because I'm a part of this partnership, and it's also fighting for me. And we're just doing initial outreach now. We've not gotten very far. So hold us to account. And based on our actual outcomes, not based on our intentions. And let's see, I'm hopeful, but we really need the support of the communities to make this a realization.
Well, I have to say, Emily, that was spoken like a true beacon. And, I do really appreciate your words there. And I think many will and many do. And, one thing that I've seen even since, working with you just a few years ago is how much the idea and the activity of meaningful youth engagement has really progressed and evolved and changed over the years. So especially this question of young people and young people's sexuality and young people's rights, which historically has been viewed in very taboo ways, is also changing along with that idea. So as someone who has helped lead the development of youth partnerships for previously FP 2020 and now FP 2030, what are the lessons that you think the movement has learned, is learning, and how can we bring those lessons into the next partnership and really into the sector?
Right. So I think we could all probably write a book about this, but in the 2 minutes or so that I have, what we've learned is that essentially our community, the SRHRJ community, has a disease. And that disease is trust issues. And the history of why that is are things we've already brought up: colonization, prejudice, racism, biases. These are woven into how we work with young people. And so we've got this disease of mistrust. We've got this result that results from this really complicated and upsetting and dark past, but now we've got to deal with the symptoms of it. And some of the ways that the symptoms of this actually comes up are in really specific ways that I think our future partnership that we are collectively building with young people is that we are going to be looking at the very concrete ways that this mistrust and the prejudice and the bias actually show up in the way that our whole community works. So very specifically, what the FP 2030 partnership is going to be doing with other, especially youth-led organizations, but other partners, is to basically say, look, that capacity building project that you're building probably doesn't actually meet young people's needs. So you might want to go back, start over, and hit rewind and hit play again and give it another go. That's one thing we're going to be really looking at, is this capacity building piece and really rethinking what assumptions are made in that. The second thing we're really going to be looking at is, yes, partnership. Actually, at the end of the day, those quote unquote paper pushers in the back of your office who are writing the terms of reference, who are writing the contracts or writing the subgrants, if you're a youth advocate, better get to know them really well. And if you're trying to advocate for young people, get to know them really well, because this is another symptom of this disease we have, is that all the ways we partner with young people manifest themselves in really backwards and quite honestly messed up agreements between donors and INGOs and local youth-led organizations and governments. And that's also because of how money flows through the system. How does money move between all of these actors along the way? So essentially, we're going to be asking the community here to stay tuned, because in the coming months, we're actually going to be launching an initiative with IYAFP, with Choice, with YP Foundation, Copper Rose Zambia, and other youth-led organizations and partners that's going to be really tackling the symptoms of this disease of mistrust that we have of young people. So please stay tuned. We're not going anywhere. We're going to keep pushing this boulder up this rock and hoping that it gets a little bit easier to work with young people equitably. So thanks everyone for sticking with us, and don't give up yet.
Wonderful. I think that's a great note to end on. Let's keep that optimism going into this new phase of partnership. And I just want to thank all three of my distinguished panelists for sharing your truth today, really sharing important messages that I hope our audience will really listen to, because the power of what you're saying is immense. And if we all take this and put it into practice, it can make a huge difference. So thank you for being here today. And that will wrap up our micro panel.
In 2013, I was able to join a group of volunteers who went to Tacloban City, which is the center of Typhoon Haiyan, around 2 weeks after the devastation. The original plan was to provide medical care and relief services to help those affected, but I saw firsthand how women and girls were severely affected by the disaster. I was able to talk to a number of pregnant women, lactating mothers, and even adolescents in evacuation centers about their experiences with unwanted pregnancies, domestic violence, and maternal health challenges. That experience opened up my eyes on the dire need for sexual and reproductive health services even in times of disasters and emergencies. My name is Erick Bernardo, a registered nurse by profession who chose not to confine himself within the four conventional corners of a hospital. Now that we are in the middle of a COVID-19 pandemic, we have been receiving reports from clients that local health facilities were either closed or that essential health workers were being pulled out of reproductive health and family planning services to do COVID-related activities such as contact tracing, swabbing, and now with vaccinations. The Philippines holds the record for having the strictest and longest lockdown in the world, and adolescents have been restricted from going out for both essential and non-essential reasons. There was even an instance when a 16-year-old girl, even though accompanied by her grandmother for her next dose of injectable, were blocked by police checkpoints. They had to walk 2 kilometers just to circumvent the checkpoint and visit the clinic. Facility-based deliveries have also been very challenging during this time. Hospitals were requiring pregnant women to get COVID-19 testing before delivery, which is quite expensive and impossible to prepare for given the spontaneity of labor. In order to continuously provide life-saving family planning services, we have implemented a strategy wherein we would meet clients who are due for injectables, for example, at their most convenient time and place. Finding a way to get women and girls the contraceptives they want and need, especially during this time, provides them full control of their fertility so they can have children when they are ready, which is equally important or especially important when their lives are shaken up by the disaster.
Hi, I am called Jacqueline Fonkwo. I'm a medical doctor from Cameroon. When I graduated from med school in 2017, I went back to my region of origin, the northwest region of Cameroon, and at that time, the region was experiencing a humanitarian crisis. Just like every other young graduate, I was really looking forward to diagnosing medical conditions and solving them, But as soon as I started practicing, I started receiving a huge number of young girls, of women who come presenting with reproductive health emergencies. It was very common to receive an adolescent presenting with a complication from unsafe abortion. And in that moment, I started understanding very early on in my practice the extent to which the ongoing crisis has had a toll on the sexual and reproductive health rights of women and girls in this region. Statistics show that 80% of health facilities and schools have been shut down in this region. As a result, young people are idle, and because they have a lot of time, and also they are victims of unwanted pregnancies. We know from UNFPA data that 50% of pregnancies among adolescents are usually unwanted, and 50% of these pregnancies end up in abortion. And most of these abortions are done under very unsafe conditions. So to help intervene, do something, I started community activism. I started reaching out to different stakeholders within the community, engaging the young people. I went to radio houses, used the radio, different platforms of the media to engage young people and parents. And I also co-founded a youth-led organization called Youth to Youth, and with support from our partners, we've been able to initiate dialogues within the community that people are not generally comfortable to talk about, because we have come to understand firsthand how life-saving family planning commodities are, especially in emergency settings like where we live and work. I am persuaded that family planning is a very essential healthcare commodity, and it's expedient that governments and different international organizations accompany governments to ensure that there are robust methods that are put in place to guarantee that family planning commodities are reaching women even the last mile, and to make sure that these are sustainable. They are not one-time interventions, but they are sustainable interventions because they are very life-saving. Thank you.
Sexual and reproductive health issues have always been there. However, being in humanitarian settings increases the vulnerability of young people to the sexual and reproductive health issues. My name is Leslie Ajani. I'm a public health expert with focus on sexual and reproductive health, and I also double as the FP2030 Youth Focal Point for Nigeria. Generally across Nigeria, young people are not often prioritized, but there are cultural, hierarchical issues that deny them access to services and information that they need to make informed choice and decisions in their life. And being in humanitarian settings, everybody's in survival mode, and this exacerbates the tension and sometimes increases gender-based violence. We've seen cases where young people access safe spaces and they feel empowered with livelihood skills and even access some small funding to start up something. And then they get back to their house, their husbands beat them, collects the money from them, with the mindset that they are female, they cannot be the ones making all the money. And of course, beyond that, there is also the issue of child marriage. Sometimes parents in these IDP camps hurriedly marry off their children because of the all uncertainties in the humanitarian setting, and then these teenage mothers or these teenage girls have to deal with closely spaced birth, high-risk pregnancy, hence the need to provide family planning services in humanitarian settings as part of the minimum package of service or minimum initial package of service provided in these settings, so that those young people or those young mothers can have access to the family planning services that they need, especially emergency contraceptives, condoms, and even long-term, longer-acting reversible contraceptives if need be. And of course, these family planning services should be provided from a gender-based perspective so that issues around culture and hierarchy, power dynamics can be addressed.
Comme la FP2030, le partenariat de Ouagadougou a été fondé afin d'insuffler un mouvement et de susciter des progrès en matière de planification familiale dans la région. Ces progrès ont été indéniables, avec 3,8 millions d'utilisatrices additionnelles depuis le début de ce partenariat en 2011. Les pays du PO ont été soutenus par l'unité de coordination du partenariat de Ouagadougou et dans une certaine mesure par le secrétariat FP2030, doublant ainsi les ressources et accroissant les réseaux qui ont permis d'aboutir à ce changement aujourd'hui. Mon équipe et moi sommes ravis de pouvoir continuer et améliorer la collaboration avec le nouveau hub FP2030 pour l'Afrique du Nord, de l'Ouest et du Centre, ainsi que la nouvelle structure qui sera mise en place. C'est passionnant de voir ce mouvement FP2030 devenir encore plus grand, encore plus inclusif. Nous avons accompli énormément de progrès ensemble, mais le besoin d'accroître nos efforts est encore plus crucial. Comme vous le savez, dans certains pays du PO, nous sommes confrontés à des crises qui menacent la stabilité de nos systèmes de santé et nos chaînes d'approvisionnement. C'est pourquoi le partenariat de Ouagadougou, dans sa nouvelle stratégie 2030, a décidé d'en faire une facette importante de sa stratégie et d'accomplir l'inclusion de la planification familiale dans la réponse au contexte et aux crises humanitaires et sanitaires. Nous continuons également dans le monde entier à ajuster nos efforts en termes de planification familiale afin de pouvoir adapter nos systèmes de santé rudement mis à l'épreuve durant cette pandémie à Covid-19. C'est pour ça que le moment est crucial pour s'engager aux côtés du partenariat FP2030 et je suis heureuse de partager avec vous que nos pays du PO ont entamé l'élaboration et la prise d'engagement auprès de FP2030 dans les 9 pays du partenariat de Ouagadougou avec la collaboration du secrétariat FP2030. Tous ces engagements auront bien entendu un focus particulier sur les jeunes et également sur la redevabilité à travers l'utilisation de l'outil Motion Tracker. Les 9 pays du PO ont adopté des engagements en 2012 et en 2017 auprès de la FP2030 et nous avons vu les progrès incroyables et les résultats sans précédent qui en ont découlé. Nous sommes prêts donc aujourd'hui à tirer profit et tirer parti de ces succès et à nous réengager dans un partenariat avec la FP2030 plus intersectionnel, plus inclusif et en fin de compte plus transformateur que jamais. Êtes-vous prêts à nous rejoindre ?